Thank you for joining Scarborough Guildwood representatives this evening. With us is the Honourable Member of Parliament, John McKay, Member of Provincial Parliament, Mitzi Hunter, and City of Toronto Councillor Paul Ainsley, with special guest Liz Buller, President and CEO of Scarborough Health Network.
Thanks everyone for joining us. Thank you for the introduction. Liz Buller, of the President and CEO of Scarborough Health Network. It really is a privilege to be joining as the guest this evening. I've been with the Scarborough Health Network for the past 3 years. A lot has gone on during that time, and in particular in the last few months with our pandemic and how we're overseeing and helping to support the community. Our vision and goal is to make sure we're transforming the health of the community, and it's a privilege to be able to communicate with you tonight and hear some of the questions and concerns that are in our community that we can both address imminently and or take away to look into further. So thank you for the opportunity to participate this evening.
Thank you very much, Liz. Thank you for sending us your questions in advance of our meeting tonight. You are welcome to submit additional questions during the town hall by clicking the Ask a Question button in the lower right area of your screen. In some places, it'll be on the top, and it'll be on the top right. Let's begin with some questions for our guest. Liz, when will hospitals reopen for treatments like fistula surgeries?
Thanks for that question. We are working on the ramp up right now of how do we reopen to full services. It's a very delicate balance of making sure that we have the opportunity to have enough occupancy or rooms and spaces should we have critical outbreaks of patients with COVID or other illnesses needing admitted to the hospital. The government requires us to have a minimum of 15% gap, so we can't have more than an 85% occupancy rate. We also have to have enough what's called PPE, personal protective equipment, of a minimum of 15 to 30 days. So we're tracking that on a daily basis. And we have to be able to make sure that our volume of patients and admitted of COVID patients is declining on a regular basis. This gets monitored weekly. We have started into phase 1 of opening up and are starting to do certain procedures in ophthalmology, in cardiology, and in outpatient diagnostics to start to decrease some of those wait lists. Again, we're monitoring them weekly and hoping to ramp up other services as quickly as we can. And hoping that in the next few weeks we'll be expanding those further. Just to reassure people, though, anyone who has emergency needs, that has been going on all the time. All of our emergent procedures, whether it's for cancer, orthopedics, gynecology, we provide those ongoing, and our emergency department is open 24/7, and we encourage anyone who has care needs to please come to our facilities and use them.
Thank you very much, Liz. The next question is, the nearest drive-through testing center is in Etobicoke. Can we bring more open-air drive-through testing to Scarborough?
We can explore open-air drive-through opportunities. We have 2 facilities right now, one at the Birchmount site and one at our Centenary. They are both mobile units, which are separate from our hospitals. So they're standalone in our parking lots. They're not drive-through the same way, but they are indeed separated from the hospital. We're seeing about 250 patients a day at each of those sites. We've had pop-up centers throughout Scarborough, 5. In the last few weeks that we saw close to 2,000 residents come through those. We're assessing the need and the situation, and if we feel we can add and or need a drive-through center, we will do that. We do that in collaboration with public health and the province in making those decisions, but we certainly aren't ruling that out.
Thank you very much. The next question is, Can I visit my mother in a long-term care facility if I test negative for COVID-19 every 2 weeks? My husband and I are seniors, and my husband has serious medical problems. So it is a great risk for us to go into a hospital for COVID testing. Do you have any suggestions for us?
So just to repeat, for us, our COVID assessment centers are independent of the hospital. You don't have to go into the hospital. It's a standalone mobile unit on the parking lot of both of our sites, one at the Birchmount site and one at the Centenary site. So you don't have to be concerned about going into the hospital if you need to get those assessments done every 2 weeks, which I know is very onerous, and obviously you want to get them done to visit your loved one. I also know we're looking at revisiting that criteria because it is quite a burden on the family to have that done. But in the meantime, please don't hesitate to come to our assessment centers. They are independent of the hospital building, and you're completely safe to use our assessment centers.
Thank you very much. The next question is, we are seeing large second waves in the USA. Following economic reopening, how worried should we be about a surge in new cases as we move to reopen?
This is a question for me again. I'm not an infectious disease specialist, so I'm going to take the Fifth Amendment on this. Mine is, I think we all just need to use good common sense and follow the guidance of our public health officials and practice what they're telling us on a regular basis. We have report outs every day and updates on a regular basis on how to make sure we're as safe as possible to mitigate the impact of a second wave. So I would encourage everybody, if you're in closed buildings, grocery stores, shopping malls, etc., use your masks. If you're on busy streets, use a mask. Don't go into large crowds if you don't have to. Practice social distancing and practice good hand washing techniques, and maintain your bubbles a while longer. All of us, I know, are feeling the pressure and getting a bit antsy, and especially with the better weather, wanting to get out. It'll help us with that second wave that will come. We don't know if it'll be a tsunami or if we'll be able to mitigate it like we have our current wave. It's been devastating for long-term care without question. But overall, compared to some of the areas of the world, we've managed it fairly well. So I think it's behooves all of us to practice and what our public health officials are telling us, and to share that information with each other and hold each other accountable when we think maybe we're not all practicing our safety standards as best as we could.
Antoinette, maybe I could jump in on this question as well, because the concern of the questioner had to do with what we see in the United States, and it's, how should we say, to put it generously, an uneven experience. Some states like New York have coped very heroically with their outbreaks and are maintaining the advice of the public health experts. Some states, Florida in particular, seem to think that COVID doesn't apply to them. So the Prime Minister has negotiated a closure of the border further to July the 21st. I know that's very frustrating for some people, but the concern is on this side of the border that the management of this pandemic is uneven, to put it generously, and we cannot afford to risk our own population, whether it's in Ontario or whether it's any other province in the country. So it is a classic example of pay attention to the public health officials. If you pay attention and endure the pain, ultimately the gain is very much worth it. So I would reinforce what Liz just said about the very practical ways in which we can flatten those curves and keep them flat.
Thank you, John. The next question is for Liz again, but you're all welcome to make comments. Is it safe to go to restaurant patios? We've been told to stay home as much as possible. Is that still recommended? What health precautions should people take while navigating the economic reopening?
Thanks for that question. I would echo what I had just said. It is safe to go to patios. I believe it is. People need to get outside, and we know the spread is less when we're outside. As long as we continue to practice social distancing. So you would have heard our Toronto public health officer, Dr. Alina DeVille, speaking about her disappointment in seeing the early openings of our patios where they were very, very congested. And I think that's a lot of enthusiasm and people just wanting to get outside. I myself have walked around my neighborhood and seen the patios are opened up, and they have tables between tables, and they seem quite safe. I think it's just practicing the same social distancing and again, using common sense. I will say I did see a cute little thing on social media this evening in Paris where they've got their patios open, and what they've done is filled the seats in between all of the chairs with humongous teddy bears. So people are keeping the social distancing in sort of a fun way. But again, common sense, good corporate citizenship together, all holding each other accountable. It is safe to be on those patios. Just don't get too carried away.
Yeah, and just from the municipal level, just to say that, to follow up what Liz has said, we have very stringent guidelines that we put in place around the operation of patios. We've encouraged businesses to reach out so they can understand those guidelines if they have any questions or concerns. We just put in place a program called Cafe Toronto, where for businesses, they can actually expand their outside patios. So we want to support our business community and get them back on track. But we also understand people want to be out and about, enjoy this beautiful weather. But saying that as well, we also have a very active licensing enforcement staff that will be monitoring all the restaurants and patios to ensure each and every restaurant owner is following the guidelines, because we want people to be safe. We're doing everything we can to make sure a second wave doesn't come to the city, but we also need people to be responsible, as Liz said, wear their masks, follow the guidelines in the eating establishments around social distancing, and I think you'll be safe.
I also just want to say that, the provincial guidelines have also come out for stage 2, which is where we are now in Toronto and Scarborough. And this is the third day. So this is the third day that restaurants are allowed in stage 2 in Toronto to be serving food on patios. Stage 2 does not involve in-restaurant dining yet. We're not at that stage. And, one of the things to look for in terms of a safe patio is just how the establishment is operating. So we want to make sure that the tables are not closer than 6 feet apart, 2 meters apart. You want to make sure that the staff that's serving those tables observes good physical hygiene, maybe wearing a mask, other types of personal protective equipment might be evident as well. And that, things like the washrooms and other areas are being cleaned frequently, and everyone is practicing very, very good hand hygiene. And the thing to watch for is that we're not exchanging droplets, that sort of, talking too close is not happening. And because the virus is still spreading, Scarborough still has a relatively high rates when you look at other areas of Toronto. So we want to be as careful as possible in stage 2. The province will be looking at the numbers pretty much every 2 weeks to see what the effects are of each of the stages. And if there's any concern, we could lose some privileges if we have to, or just stay where we are and not advance on to stage 3 of the reopening. So we want to be as careful as possible to try to avoid that second wave.
We're strongly discouraging outside karaoke.
And actually, their entertainment isn't allowed on patios yet either.
No
so
dancing either.
Yeah.
no dancing, no singing, no
No
performances.
singing. Don't get carried away.
No one has ever asked me to go in karaoke. Nobody.
The next question has to do with dining again, but this time it's in your home. The question is, can I have people over for dinner in my home if they are not in my 10-person social bubble?
Liz, do you know the?
Well, the answer would be you're supposed to have, the guidelines are to have people within your bubble. So having people outside of your bubble, obviously no one is going to police that. That's a risk that you're taking on your own. And if you're doing that, I would encourage you to make sure that, again, people are masking and you're doing social distancing. But the guidelines are, again, follow our public health officials' guidelines to protect yourself as best you can. And then it's up to our own common sense. We all have the opportunity to make decisions, but make them wisely. And if you're going to 11 people, make it wisely. If you're going to 50 people, I might rethink that. That's not where we want to go. So I would follow the public health guidelines and try to resist going outside of your bubble. It's not just for the people, the people you invite in on your bubble. It expands exponentially, and so understanding how those people, that 10 people, are going on to the next 10 people, and these bubbles expand. So I would strongly encourage people as best you can to really be patient and follow the guidelines that are in front of us.
Thank you. This question is for both Liz and Mitzi. Are you recommending testing for children and families before returning to school and daycare?
You want to start with that?
Well, I know that the provincial guidelines is not requiring that right now. So there isn't a public health requirement for testing before children return to daycare for the staff that work there. I believe for daycare that there is testing, but not for the children themselves. In terms of school, that's also something that everyone is concerned about. And, I want to just use this as an opportunity to say to all of the 2020 graduates for our community in Scarborough, Guildwood, you made it. You graduated. Congratulations. We're so proud of you. And it has been, a very difficult year for all of our students at all grade levels, but you did make it. And I know that you'll move on to do great things. So for those returning to our schools in September, right now the province has put out three choices for parents and for school boards to make. In terms of the return, there's going to have to be a lot of adjustment and changes to the classroom in order to accommodate students as they return to classroom learning. But there is not a requirement right now for testing. I don't know, Liz, if you have more to say on that.
The only thing I would add is that, we're cutting trail in front of us as we're going. We're learning from other jurisdictions as we go. So I would encourage everybody to just, again, stay tuned to our public health officials. We're fortunate to have incredible experts in our province who are helping lead the way, keeping us advised on a daily basis, like not a weekly, not a monthly. When things are changing, they're keeping us advised and expecting us to implement those changes. So right now, that is not a requirement. In August, it may be. They may have more information and feel that that's a good thing to do. So stay tuned, keep alert, and truly, I have all faith in our public health officials that are paying attention to the latest science, the latest learnings, and adjusting our policies as we go.
Thank you, Liz and Mitzi. This question is for all of our seniors. At what stage will I be allowed to hold my mom's hand who lives in a long-term care facility currently not on outbreak?
Mhm. Yeah, those again, like my earlier comments, the policies and practices, the public health officials are adjusting them as quickly as they can, ensuring we're as safe as we can be. So right now, people can visit their loved one in a home not on outbreak, but obviously still keeping social distancing, and we know that's incredibly a very big burden on families. And some find it's actually helpful and some find it's actually more challenging. As soon as we can, and the public health officials, they're very empathetic about this, as soon as they can change those guidelines and feel that it's safe for you to be able to hug your loved one, hold the hand of your loved one, they will lift those. They, all of us have lived experiences, and they do too. So they really are wanting to do the very best possible while realizing they need to be responsible for the greater good and making sure we're keeping everybody safe. So again, it's our policies and practices are changing on a regular basis to open things up as quickly as we can. Right now, we can get people to go see their loved ones in homes that are not in outbreak, and hopefully soon we'll be able to see them in a more intimate basis.
Does anybody have anything to add to that? Well, that comes to the end of our segment with Liz. Liz, thank you so much for all of your informative questions. We will now open with questions to your representatives. Mitzi, this question's for you. With the reopening of schools and the proposed hybrid model, students attend part-time, won't there be an increased possibility of transmission when those students attend multiple different childcare locations on their days off?
Thank you so much for the question. And we know that there are lots of concerns around the return to school, and there's a lot of work that the school boards have to do to prepare. I do want to go over the three options. So there's the full schedule with enhanced safety measures, such as protocols for social distancing within classrooms, enhanced cleaning, even use of washrooms and lunchrooms and those types of things, and activities. There might be more outdoor learning, for instance, so students can get outside. Those are some of the things that are being contemplated for the full return. There's the hybrid, which you're asking about, which is a rotating schedule with limited numbers of students, and obviously it has to do with strong coordination with students, parents, and the schools. And then there's home learning, which is what happened really since March when the schools were shut down. And so those are the three options that are out there right now. It remains to be seen what will happen in September. So I do see the challenges and the concerns that parents will have. I think from my perspective as the former Minister of Education, it's, how do we ensure that Ontario students are learning to a high standard in the midst of this pandemic, because that is really important. We don't want to lose time for learning for students. And, we also know that family circumstances are different in every situation. So I think that's a very big concern, is that we want the quality of education, the excellence that we have in our education system to be maintained. And then, of course, in an environment that is safe for the teachers and for staff, as well as for the students. I want to say that the standards in terms of public health in childcare and in our education system, there shouldn't be variances in that. There should be a safe space in our childcare settings as much as there is within our school settings. So that's something that I would expect would be maintained, and then we do want to make sure that our students are getting the best education possible, even in the midst of the global pandemic.
Thank you very much, Mitzi. The next question is for Paul. What changes are being made for the city-owned long-term care homes to make them safe for our parents and grandparents?
Thank you. Thank you for the question. And that's something we've been working very hard at. And when we look at we have 10 long-term care homes that the City of Toronto operates. And the two words that the process that I always talk about, I think we've started at a reactionary standpoint where we're trying to understand COVID and the impact that it had on our long-term care homes, our seniors, and our staff. And we've moved into a very proactive stage where I think we've learned a lot from the early period of the COVID-19. We've learned about trends and the impact on PPEs and the equipment we need and the staffing, even the layout of our long-term care homes. I think we've come a long way. Most of the numbers of both staff and residents that are ill in our long-term care homes has gone down quite a bit. We have the proper equipment in place. We do temperature readings twice a day. As I said, we've restructured the homes so there's more space. But I think it's an ongoing lesson and learning experience. But I think we've come a long way. Thank you.
I think, and Antoinette, I think it'd be useful if Liz jumped in here to talk about her, the Scarborough Health Network and its role in Scarborough and some, should we say, supervisory responsibility with respect to the long-term care network, or not long-term care homes in Scarborough. I think our listeners would find it quite interesting.
Sure. So there are 22 long-term care homes in Scarborough, and we're overseeing 20 of them, and that's just because they sit on the borders. So Michael Guerin oversees one, and North York General oversees one of the others that sit on our borders. So we have 20, which is amongst the largest amount to be helping to provide care for. I will say the municipal homes have the lowest risks of all of our homes, nonprofit and for-profit homes, and have quickly been able to pivot and readjust, as Councillor Ainsley was saying, to accommodate the needs of improved infection prevention control practices, models of care practices, patient flow practices. And so one of the early homes that were in outbreak was Seven Oaks in Scarborough, a municipal home, and they were very quickly very responsive. We worked very closely with them, and we were able to provide educational services around infectious prevention control, environmental services, and physician services, including palliative medical care, mental health services, and also spiritual care services for families and staff and residents. So we actually have created a menu of options for all of the homes in Scarborough for where they feel they need support. And as I mentioned earlier, we meet with them every Thursday, led by our Executive Vice President, Dr. Bert Lowers. He reviews all the recent changes and policies in the province and or locally. But the municipal homes have been very, very responsive and very strong and are a good model for us to work with. The others as well, we have oversight for 2 of the private homes right now, helping to manage and support them. Very collaborative relationships. I think overall, out of the 22 homes in Scarborough, we only have 1 in the yellow now. We've moved everybody almost all into the green and out of outbreak. So we're in a good place working together. Yeah.
Wonderful. Thank you. John, this next question is for you.
Okay.
What is the to-date estimated future costs of COVID-19 related benefits, including grants, forgivable loans, and other supports? Is there a plan being put in place for repayment of these expenses?
I was kind of hoping that you'd come up with that, Annette. This is a massive amount of money. The Parliamentary Budget Office is at this point estimating 150 to 160 billion dollars in deficit spending. To give you some perspective on what that means, that is roughly one half of the federal government's overall budget on an annual basis. So the annual budget of the federal government is about $300 billion. We are going to deficit that by 150 to 160 billion dollars. So that's a lot of money, and the federal government has a very major problem on its hands. Therefore, we have a major problem on our hands, and it's twofold. The first is the sending out of all of that money, and it's been primarily sent out under the Canada Emergency Response Benefits. So that was about a 60 billion item there, and the wage subsidy is another 45 billion. And after a while, these numbers just don't mean anything to people because they can't relate to it. But suffice to say, it is a massive amount of money. So on the one hand, we're sending out a whacking big chunk of money. And on the other hand, the revenues are way down. And as you can appreciate, you just need to look around your neighborhood to realize why they're way down, because the economy contracted significantly. People are unemployed. And when they're not working and when the economy is contracting, then there's no tax revenues. And if there's no tax revenues, you double your problem. So come this time next year, we'll probably have a better feeling for what our economic and fiscal picture looks like. The government is giving a statement on July the 8th as to what the current situation looks like. But to be candid about it, it is an educated guess. All of the benefits have been going out. That number, you don't really know what the number coming in is going to be, and therefore to give you a hard and fast difference is extraordinarily difficult. We are going to be digging out of this hole for quite a number of years, and I have no real good insight as to how we're going to dig out of this hole, other than we're going to have to all do it together. The good fortune is that Canada was in great fiscal shape going into the pandemic, with a debt to GDP under 30%. We are probably going to be up around 45%. So that's a huge change, and it's going to affect everybody in this phone call. So when Paul, on behalf of the municipality, asks for money, it's going to be difficult. When Mitzi returns to government, we know that that'll happen sometime sooner rather than later. But even before she returns to government, the current provincial government will be asking for money, and we will have to say we don't have any. And of course, that has significant implications for Liz's budget, because healthcare is a very significant component of the provincial budget, and the hospital network will be, of course, a significant component of the significant component. So, ladies and gentlemen, we as Canadians, we as people from Scarborough have a massive problem, and I don't think I can underestimate the problem, and it will affect every one of us. There's your depressing answer for the day.
Friday night. Oh,
Yeah.
John, you could have at least cracked open a beer or something.
Yeah. Well, we can't crack open champagne, that's for sure. Although if we continue the success rate that I think the public health authorities are having on flattening that curve and starting to get a little bit better handle on COVID, then I think we may not be able to go to the champagne just yet, but we might be able to at least put it in the fridge.
Thank you, John. The next question is for Mitzi. When will Service Ontario centers reopen?
So the good news on that one is that the majority of them, as of June 24th, have reopened. So 96% of those locations that are run, that are public, are open, and 80% of those that are private locations are open. I do want people to remember, though, that online is also a great option and far lower risk to the staff that work at Service Ontario and for your interactions with the public. And so if you visit ontario.ca and there's a service search for the Service Ontario centers, you'll be able to do many of the services online without having to go in. And also there's an extended validity period for things like license plate stickers and that sort of thing because of the emergency pandemic as well. So, although those sites are open, we're really encouraging people to take a look online to see if you can do what you need to do in that format, and then you can get your sticker mailed out to you.
And I can contest it works, the online.
Yes. It works, and it works really well.
Works really well.
Free.
Thank you, Mitzi. The next question is for Paul. When will municipal licensing standard law start enforcing complaints through 311 again?
Okay, so thank you for that question. So our licensing staff, have a timeline of July when our licensing staff, in particular our property licensing enforcement officers, are going to be back to their regular jobs. We made a very concerted effort and a decision to decide to redeploy all of our licensing staff into dealing with social distancing, making sure grocery stores in particular were following all of the social distancing, the bylaw that was put in place around social distancing. But I do encourage people, because it is beautiful weather, everybody's out and about, you're in your neighborhoods looking at things, you're looking at the roads. Unfortunately, illegal advertising signs that are up, people are still throwing garbage out and about, which they shouldn't be. But feel free to contact my office. We are keeping a running tab and a total and a list of locations and concerns so that when our licensing staff are back online in their pre-COVID-19 duties, that we'll get as many issues cleaned up as quickly and efficiently as possible. Thank you.
Thank you, Paul. The next question is for John. In reference to the OAS and GIS, the announcement mentions allowance recipients. Who are the allowance recipients?
I'm given to understand the allowance recipients are the spouses of recipients who are between ages of 60 to 64. And as I understand it, there will be an additional $500 available to them.
Okay, thank you so
That was
much.
very efficient, John.
Well, every once in a while, I like to answer a question economically.
Your last depressing answer, thank you.
Yeah, that's right. That's right. Well, I can relate it to the last depressing answer because, this is a serious amount of money. I don't know how many GIS, OAS recipients there are, but it's more than 1 million, and it's probably closer to 2 million. And you end up, if you send out $500 to 1 million people, it starts to add up very, very quickly. So, anyways,
but it is very well appreciated, John. I've heard from a lot of seniors that they're interested in municipal programming, but they do mention the federal ones as well. So I know they're very well appreciated.
Well, they're also getting the HST credits as well. The juiced up HST credit, they got it early on in April. So there's been quite a number of rollout programs. But if I just go back to my previous answer, the cost on the HST credits at this point is $5.5 billion.
Yeah.
Those are realities. So sorry, Antoinette, we turned an economically answered question into a less
Lively discussion.
answered question. Yeah.
I would just say, I don't know I always get in trouble in healthcare for using acronyms, so I don't know if everybody on the line knows OAS is Old Age Security and GIS is General Income Supplement, because I didn't know until I texted David, who's there, and I'm like, what are those things? Can I get some of that $500? I can't yet.
No.
We'll move on to the next question. This one is for Mitzi. How is the government helping small businesses recover in the wake of COVID-19?
Well, this is something that we really need to focus on. And when John was speaking about the state of the economy in Canada, we also have a provincial lens as well. And the reality is, from our original economic forecast that our Minister of Finance put forward in March, was March 25th, to May and June, the reforecast by the Financial Accountability Officer, we lost $23 billion in revenues. And that's part of the downturn in just less activity, less personal income taxes, less corporate taxes being paid. And when you think about the fact that half of Canada's GDP is from small businesses, you realize that we've got to really work hard in the recovery to make sure that small businesses, they survive, and that they are able to come back, because they're major employers, major parts of our community. In Scarborough, we have many independently owned small businesses, and the Scarborough Business Association is doing a great job every week, of bringing together the small business community for conversations in terms of, how can we support them? Many of them want to see, for instance, support for rents. It's a huge cost, commercial rents, and they want to see those programs. There is a federal program that helps with that, but it's dependent on the landlords participating, and landlords have been slow to participate. So that burden is falling directly on our small business owners and operators. And so that's a very big one. Something that we did manage to get done provincially is put a moratorium on evictions for commercial rents. And we've the work from our Liberal caucus and our Green Party member allowed the government to move that back to May 1st. And so there is no, landlords are not allowed to evict at this time during the pandemic. So that's helping small businesses. But there's a huge concern right now, even though we're in stage 2 and we've opened, it doesn't mean that people are rushing back into those businesses. And so one of the things that I've held 2 roundtables with small business owners, and one of the things that became really, really clear is employee confidence. Believe it or not, how your employees feel about returning to work transfers into the confidence that they pass on to customers, and they pass that on to suppliers. So I would really encourage small businesses to make sure that they involve their employees in the reopening stages, make sure they're comfortable, make sure the work environment is comfortable for those employees, because that will go a long, long way in building the confidence that you're going to need to reattract those customers. Small businesses require liquidity. That's also an area. And while our provincial government has invested $17 billion into the COVID recovery, $10 billion of that is in tax deferrals. So things like deferring the WSIB premiums and other types of payments to the government. And the concern that we have, and I actually asked a question this week of the finance minister, and he said he was going to take it under advisement. Rather than having small businesses repay those deferrals in the fall, give them a year or more to repay, so that they can protect their liquidity as they're getting back up, and make sure that they are strong enough in order to pay those tax deferrals. So those are just some of the areas, but there's a long way to go. And you can think about this by each sector. You think about the personal care, hair salons, and those types of things. Barbershops are now opening. but they have to do that with social distancing. They have to invest more in PPE and sanitization, so that their costs have gone up. In some instances, some of our restaurateurs are telling us that they have to hire more staff to serve less people because of the new standards and the new guidelines. I sit on a committee that is listening, helping the government to come up with a budget for the fall, and many operators are very concerned about the increased costs to meet the new guidelines, and where is that money coming from? So there's optimism and there's hope as we work together to fight the pandemic. But there's also many challenges ahead as well for our small business community, and we have to make sure that they survive in Scarborough. One of the things we're working on with the Scarborough Business Association is, building pride in Scarborough and doing a Scarborough Strong campaign that really encourages the local community to support local businesses, because that's really the only way they're going to survive is if you support them.
So, Antoinette, just to pick up on Mitzi's comments about the revenues being down for the Ontario government. So I think you used the number 23 billion. So pretty well double that plus for the federal government. And the significance of all of that is that Ontario is the engine of the Canadian economy. So if Ontario is down, the rest of the country is down to a large extent. And the GTA economy is half of the Ontario economy. So when the GTA is the last to come out of the various protocols, it actually has a very significant ripple effect through the Ontario economy and through the Canadian economy, because so much economic activity happens here in the GTA. And so ironically, the less quickly we come out, the less quickly the nation comes out, and that's all driven by the fact that Toronto is not moving out of the lockdown as quickly as maybe it could or should.
Yeah, and I would just like to add, along with John and Mitzi, is the City of Toronto, we do have a recovery and rebuild office that we just recently created to support the business community as we're coming out of the COVID crisis. I'd encourage any business owners that are watching today, if they go to the City of Toronto website, it's easy, toronto.ca. Right on the homepage, there's a link to our COVID information. And we are doing a survey for businesses to get their feedback and input on how we can help them as a municipality to give them that foundation they need to successfully get out of COVID-19. Thank you.
Thank you. The next question is for Paul, and it has business related as well. With the Cafe TO, Scarborough doesn't have many BIAs. The question is, how will Scarborough restaurants be helped under the new Cafe TO program?
Yeah, so Cafe TO, it's a program that we've just created. It's looking at restaurants and eating establishments and where we can add additional patio space because as was mentioned earlier, the costs of putting in the equipment and barriers and making sure your staff have the proper equipment so they are safe and can properly serve their patrons. So we have a program in place called Cafe TO to expand the patio areas and the eating areas outside the restaurants, taking advantage of the good weather here. For myself as a city councillor from Scarborough, one of the concerns that I raised is that one of the parameters of the program is it's money that goes to our business improvement areas that are throughout the City of Toronto. Unfortunately, here in Eastern Scarborough, we do not have a lot of business improvement areas because our businesses are mainly what I refer to as small businesses, mom and pop operations. So I have asked the city that we need to have some type of mechanism in place to support eating establishments that are not included in business improvement areas, because part of the cafe program as well, many of our restaurants here in Scarborough have a parking lot outside them. The whole idea behind Cafe TO is you can expand the patio space in front of your restaurant into the roadway right in front of your building, which often doesn't happen in Scarborough because they're on private property with a parking lot, a boulevard, a sidewalk, and another boulevard. So they don't really fall into the guidelines of Cafe TO. What we've actually need to be doing is we have to change zoning bylaws. So we have actually asked the provincial government, the finance minister, for what's called an ordering council, so that the zoning bylaws can be done by individual councils and not have to wait for provincial approval. So we are doing everything we can to support businesses. We look to the province for some help, but certainly want to get our restaurants up and going again, making sure that people can enjoy the patios and get out, follow the rules, and be safe, and support our local economy. Thank you.
That's really good. I wanted to, first of all, I absolutely would support the request. And as the finance critic for the Liberal Party, I'll probably mention to the finance minister that I completely support the request from the City of Toronto to really give the zoning flexibility right now during the pandemic so that you can do what you need to do. I want to also say, because the provincial government has set up Ontario Live, and it's for festivals and attractions, and there are different types of initiatives that are being posted there, and the whole focus is to boost local and domestic tourism, given the fact that the borders are closed, and many of the attractions, like the zoo and the Guild Park with the Guild Festival Theatre, and many of our attractions are not going to benefit from having the same level of activity that they would normally have. So Ontario Live is really geared towards letting people know what is going on in Ontario, so that they can get the support of domestic tourism as well. So I would encourage any of our operators to sign up for that, to get the exposure, because it's there. The site has been built. I went on it, actually. It's quite good. And I also want to give a shout out to the Guild Festival Theatre for being so innovative and creative, doing porch plays, pop-up plays, and with the hope of doing a drive-in play in August. And I think that that's the kind of creativity and innovation and resilience that we need to see, so that we can survive this very difficult year and start planning for next year.
I would just throw a plug in for the zoo too. I think they've done an amazing job of being creative with their drive-through. And I saw tonight online that they're actually opening up to the public tomorrow to actually physically walk through again. So anyone who's listening who can get to the zoo, be outside, it's open again. So
yes,
we've had really creative businesses. And I would also say, from the small business side, as Scarborough Health Network, the innovation and support that we've had from small businesses in Scarborough has been just tremendous in sort of shifting their business templates to help support, whether it's been with masks or face shields or hand sanitizers. Any way they can help has been just tremendous. It's really been heartwarming to see how the communities come together so strong.
Thank you. I also would like to note is the Guild Alive with Culture Festival is going to be online this year, starting July 1st. That is a festival that Councillor Ainsley hosts the community. John, this question is for you. Early this month, the federal government issued a statement that they will grant a one-time payment of $600 to persons with disabilities holding a disability tax credit certificate. May we know the status of this?
It's not very good. That was part of a budget proposal of about $87 billion in spending that was put before the House, and the agreement among the parties to pass that bill fell apart with the falling apart. Then that legislation didn't pass, and if the legislation didn't pass, then the tax credit won't go forward, and so at this point we are in a bit of a limbo. I believe that Parliament is scheduled to resume for a one-day sitting in July. The date escapes me right now. I think it's around the 20th, and possibly at that point the legislation will pass.
Thank you, John. Mitzi, this
You want
question.
another depressing answer?
No, no more.
Who invited him?
I know, for goodness sakes.
He comes with the trio.
I feel like I'm Debbie Downer, you know, like for goodness sakes.
Every Friday night with you guys.
Yeah, well, as you know, no one invites me out for karaoke.
I do want to say, John, that on a happy Canada Day, July 1st note, that I do see your happy Canada Day lawn signs popping up around Scarborough, Guildwood. So I think that's a great initiative for people to support our national holiday, and good on you.
We were actually out today delivering signs to the various people that have requested them. However, we drew the line at going to Mississauga. Somebody from Mississauga wanted to know, if you want that sign, you're going to have to come to Scarborough, Guildwood, which, of course, as we all know, is the center of the universe.
That's right.
Yeah.
Despite your disclaimer, John.
Yeah, that's right. That's right.
Thank you. The next question is for Mitzi. How are you helping renters facing difficulties during COVID?
I mean, this is definitely the issue that came to the forefront in March, really, when the stay at home and the lockdown was required and people couldn't go to work. And, you know, it really hit many individuals that are struggling to pay the rent. A lot of service jobs, for instance, were the first to be closed down. You know, not everyone has a job where you can work from home and see no interruption in your income. You know, thankfully, the federal government with the CERB and other programs helped to provide, you know, some income to people, but still, it was probably less than what they would normally earn. And so we've been lobbying the provincial government to do what other jurisdictions like BC, for instance, gave $500 to tenants to help offset the cost of rent. But so far, there hasn't been rent relief for residential tenants in the province. There are no evictions happening at the landlord and tenant board, so there's that relief there. But in terms of sort of cash payments to renters, that has not happened provincially. We continue to call on the government to recognize the plight of renters. You can see in Scarborough, the food bank use has gone way up. It was already high, you know, we know that, but it has gone way up with a lot of first-time food bank users because they just simply are not able to make ends meet during this very, very challenging time. So it's an area that remains a challenge as long as things remain sort of in the slower recovery stage. We haven't seen, you know, everyone go back to work yet. There's over 2.2 million Ontarians who either have lost their job or they've seen a very drastic reduction in their jobs. And so giving relief for rent is something that would help many, many, many people.
Thank you, Mitzi. The next question is for Paul. Are community drop boxes open for drop-offs, and where can residents drop off old electronics, TVs, and computers?
Yeah, so at this point, you'll see the community drop boxes throughout Scarborough still have the yellow tape around them. They are not open at this point. As we continue into stage 3, I think you'll see them open. But we do have 7 what are called transfer stations around the city, and they're fully open. And for things like electronics, batteries, anything like that, you can look at online for the pickup days in your community for garbage. But any recycling that needs to be done in terms of electronics can be put out at the curb, and we'll get it picked up. And for larger items, they can be dropped off at our transfer stations. So thank you for that questions as well.
Thank you very much, Paul. This will be our last question for the evening, followed by a message from each of our representatives and guests. John, this question is for you. Is the federal government looking at supplementing support for childcare?
Well, the main supplement for support for childcare is the Canada Child Benefit. And the Canada Child Benefit in Scarborough Guildwood means $100 million a year coming into Scarborough Guildwood. It is actually, the riding is actually the largest recipient of the Canada Child Benefit in the country. And so you've got better end of $8 million coming in on a monthly basis into the hands of parents. And of course, it's a welcome amount of money. There was a one-time shot in April or May, I believe, announced in April. Check arrived in May to help families through the COVID experience, and I'm a big fan because it puts money in the hands of the people that need it the most, and it will be spent locally. So a mother, a father, a family that receives $1,000 or $2,000 in their bank account on a monthly basis spends the money on children's clothes, spends the money on children's shoes, spends the money on education, spends the money on food, and things of that nature. So it is not childcare per se, but it is substantial family, substantial help to a family, and they will in turn spend the money in a way that is most beneficial to that particular family in that particular circumstance.
I do want to jump in as well in terms of the need for childcare as part of the economic recovery. You know, I've called this a she session, because when you look at the loss of many of those jobs, those service jobs, many of those jobs were held by women. And when you look at the statistics on the recession, it's women that have borne the brunt. As the economy is recovering, actually most of the jobs that are coming back quicker are male-dominated industry jobs. Your infrastructure, construction type jobs. In fact, construction never really closed fully, and so that's a big concern. And childcare is very much a part of that in terms of giving families the choice of returning to work, who returns to work, when school comes back. How does our childcare meet the needs of those families? And we're not going to fully recover from this recession without childcare being a factor. It's been a little bit of a bumpy opening in Ontario because childcare operators are still waiting for funding that they've demanded, because all of those new standards that we've talked about for all the sectors also affect the childcare sector. And where do those costs come from? Do those costs be passed on to those families by increasing the cost, which was already very high, or is it government that would assist in providing some funding so that those new standards can be met? And we can maintain spaces. So there is a risk here in our reopening if we don't get childcare right. And so raising questions about childcare, I welcome those questions into my office. We've written to the minister over the course of the pandemic to talk about concerns around childcare, and we'll continue to advocate for more better childcare and investments in that.
Thank you very much. With this, we'll start with our closing remarks. Liz, we'll start with yourself as our guest.
Well, thank you again for the privilege of joining you this evening. I really appreciated the questions and have a good understanding of some of the concerns that are out there. We'll continue to try to provide the best information as expediently as possible for the community. And again, I would just encourage people Please know your healthcare facilities are safe and available to you. Please use our emergency departments. Don't stay away. We do have 2 assessment centers. Please get tested. They are standalone and they're safe as well. And please continue, be patient, practice your social distancing, wash your hands, and wear your masks in public spaces. And be safe, be well. Have a great weekend and happy Canada Day, as well as Councillor Ainsley started to mention this evening. Thank you.
And thank you so much, Liz, for joining us. This is our 3rd virtual town hall that we've done as the elected representatives for Scarborough Guildwood. And I have to say, it's been a joy having you on with us, and you're welcome back anytime. Yes. And I do want to, say to our residents in Scarborough Guildwood and across Scarborough and Ontario, frankly, who will be watching, and you've been really, really incredible. The fact that we are in stage 2 of the recovery has been because of your sacrifice and staying at home, following the advice of public health, and all of the sacrifices that you've made. That's why we are at the stage that we are in right now. But we're not through the pandemic yet, and Scarborough remains a hotspot. It remains an area that we have to be really careful about. So if you are venturing into areas that you can't physically distance, remember to wear a mask. If you need a mask, maybe reach out to us, and we'll try to find a way to connect you with that type of protective equipment. You can just wear a scarf as well. Any covering of your face will protect you and others, and keep you as safe as possible. It's important that we get through the next few months as healthy as possible and as safely as possible. So I too wish you a great weekend. Enjoy it. Get outside and enjoy the fresh air. It is time for us to do that now and do it safely. And happy Canada Day. And I want to thank my colleagues, John McKay and Councillor Ainsley. It's really wonderful working together with you in common cause here in Scarborough Guildwood. So thanks, everyone. Happy Canada Day.
Thank you, Paul. Would you like to sign off?
Oh, okay. I was going to defer to my federal counterpart.
Up to you.
John?
No deferral necessary, Paul. I'll do bad. I'll back clean up.
You see the following of instructions here that happens with these two.
I was only deferring because he always writes the checks, which I appreciate as a municipal government.
Yeah. Okay.
John. I want to start off by thanking Liz Buller, the CEO of the Scarborough Health Network. Liz, for all your tremendous work and leadership at all 3 hospital sites here in Scarborough. Having over a quarter of the population in the GTA, healthcare, I think, is always of paramount importance to everybody. And if you can pass on our thanks to all the frontline healthcare workers at all 3 sites, I think, we can't thank them enough for everything that they do. And I'd also like to give a shout out to the Scarborough Health Network Foundation. If you want to give some financial support to those frontline workers and everything that they do, we have a tremendous foundation at the Scarborough Health Network. I want to thank John and Mitzi for another town hall. I think this is very reflective of the love that all 3 of us and care that all 3 of us have for the Scarborough Guildwood community. And I want to thank the residents for the questions that they've sent in. And once again, encourage everybody to follow the social distancing guidelines that we have in place for your safety and our community's safety. And I want to wish everybody a wonderful, happy Canada Day, and enjoy your time with your friends in your social bubble. Thank you.
So apparently I'm batting cleanup. I really don't want to thank anybody for those questions. I feel like I'm Debbie Downer for this crowd. but the questions were difficult, and apparently there's a few others that are even more difficult. It's been a delight to have Liz with us. I don't quite know that everybody appreciates what a real asset we in Scarborough have in Liz Buller and the Scarborough Health Network. It is a very significant health network. My recollection is it's the third largest health network in Ontario, and it serves us well, and it's serving us even better as it takes over some supervisory responsibility with respect to the long-term care homes. So I have some confidence that if and when we have a second wave, that we are much better prepared. So I want to thank Liz and the Scarborough Health Network for that. And the other, I want to thank Mitzi and Paul as well. One of the reasons we do this is not only to hear your concerns, but to show a level of cooperation among the three levels of government. I know these guys are always asking for money, but they actually are nice people, notwithstanding that. We are coming up to Canada Day, and I think this has been 2020 has been a year of immense challenge, and it's not just been the pandemic. There's been other challenges that we've had to face as a nation. Yet it is a day in which we reflect that we live in the best nation on earth. And we are very fortunate and blessed people. So on that note, happy Canada Day, everyone.
Happy Canada Day.
Okay. Thank you.
Happy Canada Day.